Asthma is a chronic lung disease that affects millions of people worldwide. The condition is characterized by wheezing, shortness of breath, inflammation, and chest tightness. It causes the airways to become narrow, which results in difficulty breathing. There are several variables that influence the prevalence of asthma within the population, including both genetic and environmental factors. With that said, one factor that people often forget about is their diet and the foods that they put into their bodies. There are several foods that can reduce inflammation and help improve your asthma symptoms. However, unfortunately, many of the common foods we eat contain properties that worsen asthma symptoms, making it more difficult to breathe. And that is the topic of this video. Keep watching until the end because there are a few that I think will surprise you. So if you're ready, let's get into it. Most research on the increasing prevalence of asthma discusses the growing popularity of the so-called Western diet. That's because residents of the United States and many developed nations tend to eat fewer vegetables, fruits, legumes, and whole grains than they did in earlier generations. In their place, these populations have increased their consumption of animal products. And the result of these eating practices is the ingestion of excessive amounts of saturated fat and far fewer servings of fruits and vegetables than recommended. Therefore, the prevalence of asthma tends to increase in cultures that embrace the Western diet. Understanding the basic elements of Western dietary practices illustrates the underlying factors of this increase in asthma attacks and how public health and medical intervention should respond. Again, the Western diet emphasizes the convenience of processed and preserved foods, as well as readily available fast food selections. Some examples include fried foods, sweets and desserts, refined grains, processed and red meats, and high-fat dairy products. These often have higher levels of sugar, sodium, omega-6 fats, and saturated fat. With a reduced emphasis on fruits and vegetables, this diet has lower levels of antioxidants, micronutrients, phytochemicals, flavonoids, fiber, and omega-3 fatty acids. This combination of low fiber intake and higher amounts of bad fats tends to increase airway inflammation, negatively impact lung function, and increase the potential for frequent asthma episodes. Therefore, here are some of the symptoms. Foods that may worsen asthma symptoms. This includes fast food, trans fats, omega-6 fatty acids, foods high in sulfites, dried fruits and vegetables, vinegar, pickled fruits and vegetables, shellfish, alcoholic beverages, processed meats, and dairy products. There are several reasons why these specific foods can make your asthma symptoms worse, but it all boils down to inflammation. Inflammation is the body's natural response to protect itself from infections, injuries, and irritation. However, if this response persists, it becomes chronic inflammation, which can damage healthy tissue and lead to various health problems, including respiratory infections, as well as difficulty breathing. So do your lungs and entire respiratory system a favor by eliminating these foods from your diet. And now you may be wondering about the best diet for someone with asthma. The best diet for asthma. In general, scientists believe that there are actually two diets that may benefit those who suffer from asthma symptoms: the Mediterranean diet and a plant-based diet. These are vastly different than the typical American diet, which consists of high-fat, fast food dishes that are frequently made from heavily processed food items and preservatives. They typically consist of foods that are locally harvested, seasonally fresh, and undergo minimal processing. These diets include fewer dairy products and red meat as well. Instead, olive oil serves as the primary source of supplemental fat for most Mediterranean dishes. It contains a long list of antioxidants, such as vitamin E and phenolic acid, which help lower inflammation, which makes it easier to breathe. Not to mention, these diets have lower levels of trans fats and omega-6 fatty acids, which tend to increase or exacerbate the frequency of asthma episodes. As previously mentioned, there are several foods with anti-inflammatory properties that may help reduce the effects of asthma. This includes fruits and vegetables, apples, citrus fruits, leafy greens, tomatoes, beans and legumes, turmeric, ginger, salmon, and flax seeds. There are several reasons why these foods can help asthma symptoms, but it's generally thanks to vitamins, minerals, antioxidants, and anti-inflammatory properties they contain. For example, ginger and turmeric are flavorful spices rich in bioactive compounds and properties that can reduce oxidative damage and provide many positive health benefits for the human body. This includes improving the body's antibody response while reducing inflammation in the airways of the lungs. Not to mention, foods like tomatoes are loaded with lycopene, which is a carotenoid antioxidant that has been associated with improved respiratory health. This may be especially beneficial in those with asthma or COPD. Again, it all boils down to inflammation. Asthma is a chronic, obstructive respiratory condition that causes inflammation and narrowing of the airways in the lungs. This leads to recurring episodes of wheezing and difficulty breathing. The causes of asthma involve a combination of genetic and environmental factors. Some examples of the most common asthma triggers include pollen, dust, grass, animal fur, cold air, exercise, stress, cigarette smoke, and respiratory infections. Each patient is different. Therefore, each patient may experience an asthma episode due to different triggers. The long-term management of asthma symptoms is important in order to prevent acute exacerbations and improve your quality of life. This involves eliminating or minimizing the triggers that can cause an acute episode. The management of asthma often requires the use of controller medications such as beta agonists and inhaled corticosteroids. However, as previously mentioned, research has shown that your diet and the foods that enter your body can also play a major role. So do your lungs and entire respiratory system a favor by eliminating unhealthy food choices while including more of the anti-inflammatory foods that we just discussed. If you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you'll enjoy. And just a quick reminder, we are not doctors, and this video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.